Healthcare facilities across the nation are finding ways to cut costs without affecting quality of care. Just this year, Memorial Sloan Kettering Cancer Center decided not to offer the drug Valtrap for the treatment of colorectal cancer. At the 8th Annual Chicago Supportive Oncology Conference, Dr. Tom Smith said the center's decision could be a game changer.
So Memorial Sloan Kettering recently decided not to pay for the most expensive new colon cancer agent. They didn't say, well, we're not treating colon cancer anymore. What they said was, we already have an agent that does the same thing. It extends the progression-free survival by a month or two. And this new agent is priced a whole lot more for exactly the same benefits and essentially the same side effects. And we just decided, as Sloan Kettering, that we simply can't afford to keep paying for such things. So they made a decision that they're not going to pay for this new drug. It'll be interesting to see what happens, because the people who make the new drug could say, well, people will go elsewhere for their care, or they could say, at what price would you buy this new drug? And maybe they'll lower the cost.
Dr. Anthony Bach, oncologist and professor of medicine at the University of Washington, discusses the issue of hospitals and physicians shifting their focus from cost to quality, and what doctors should be telling their patients as to why they're not choosing a more costly treatment.
The mistakes that physicians make related to cost are just talking about cost as a single thing. This is too expensive. That's never going to work, and it makes people really anxious that you are withholding some kind of treatment that might be, dramatically beneficial to them. And to be honest, I think that many of the cost issues now that we're talking about the most are things where there's huge cost and very marginal benefit. And so I think for you to put that in perspective as a clinician for them is hugely beneficial.